And so, again, this is Medication Safety and Script Talk with Sharla Glass. Thank you. You may continue.
Okay. So a little background with Script Talk and the scriptability software, which is what the pharmacy uses to program the Script Talk labels. We actually first started out about 20 years ago working with the Veterans Administration. They were our first customer. So if you are a veteran, you can go to pretty much any VA hospital or outpatient clinic and have Script Talk prescription labels put on your medication. After we started with Script Talk, we had a lot of people talk about how, well, they don't really need Audible, but they really need a large print label. So then we worked on creating another kind of label that was large print. The main thing with large print labels is that it's really hard to get it all on the bottle. If the pharmacist makes it a larger font, how do you get all that information on the bottle? So Dave, our guru, invented this special kind of label, and it turns into a little booklet, and that one's falling apart. That one's really old. But it turns into a little booklet that has all the large print information, and the pharmacy can print as many pages as they need to get all that information on there. And then we also have a Braille label, which is a clear, and of course you can't see it really because it's clear, but it's a clear Braille label that can go over top of the regular medication label. And so our software will actually allow a pharmacy to produce any one of those three. They get to decide which labels they're going to offer their customers. So some of the pharmacies we work with, they provide all three. Some only provide the Script Talk label, and some, only do Braille, or some do, Script Talk and Script View. So it just kind of depends. And I won't get into it a lot today, but our Script View label can also be a dual language label. So the pharmacy can also translate in using our software the directions into many other languages. So there are a few states that are requiring dual language labels for those who speak another language. And so that's another accessibility feature, not necessarily for the blind and visually impaired, but for other people who can't read English. So we have scriptability software. That's what the pharmacy installs in their pharmacy. And then they can create these labels. I didn't really show the Script Talk label. This is the Script Talk label. It's about the size of a quarter. And the difference with this label is that it has a microchip and an antenna in there. So it's an RFID tag. And so that microchip that's in that label can store text. So basically, this is a text-to-speech technology. And then, of course, you need a device of some sort to read that label out loud, to take that label and to put it into speech. And you have two options of how to get that information spoken out loud to you. The majority of our customers are preferring the smartphone app nowadays, but we know we have other options as well. Our smartphone app is called Script Talk Mobile. We have both Android and iPhone technologies or apps. This is a very basic application. Once you open it, you can pick full scan or quick scan. It works really great with VoiceOver, but I don't have VoiceOver turned on right now, so I'm just going to press the button. So full scan, I don't know if you can hear that. It's going to start ticking. The ticking means that it's looking for an RFID tag. So then you can just put the medication up there. And
patient name, Sally Safety. Medication, Happy Pills 10 milligrams. Instructions, take 1 pill every day. Quantity, 30. Fill date, April 1st, 2018. Use by date, April 1st, 2019. Refills remaining, unlimited. Prescriber, DRIM, independent. Scriptability Pharmacy. Pharmacy phone 800-890-1180. Prescription number, 123456. Other information. Warning. Staying safe with your medications may cause a longer, happier life. Warning. Increased chance of confidence and independence. Warning. May cause a sudden desire to tell everyone you know about Script Talk.
All right, and then there's also an other information, and if you have the app, if you press on that, it will take you to another website with all of the fine print information that they usually give you that handout at the pharmacy. So that's the app. But then if you are not a smartphone user, we do have this Script Talk device, and we have what we call our Pharmacy Freedom Program, which allows you to borrow one of these at no cost for as long as you need it. And you can go to any of the participating pharmacy, hence the name Pharmacy Freedom. You can go to any of the participating pharmacies and use this device to hear the medications read aloud. And I'll give a demo using this one.
Script Talk station ready.
Okay, so it has 3 buttons. It has 2 arrows, forward and backward, and then it has a play button, and then a volume switch that also turns it on and off. So you just press play, and like the app, it starts to tell you it's looking for the you just put it on top.
Patient. John J. Smith. Medication. Amoxicillin. 250 milligram capsule. Instructions. Take 1 capsule 3 times daily. Quantity, 30 capsules. Prescription date, August 1st, 2013. Use by
So I'll just kind of demo the
31st,
arrows.
2000. Use by
You can just flip
July
through
3rd. Refills remaining.
to find the thing that you want.
Scriptability to reorder this prescription, dial area code 309.
So like if you just, what if you just want to remember what the warnings are?
Other
You can go forward to the warnings.
Take for infection. For more info, dial 309 268 9754. Enter code 3295.
Okay, so that's what I was talking about. We'll give this phone number and this code, and if you dial that, that will give you all the extended information. Because this microchip can hold 10K of information, but sometimes those fine print sheets have way more than that. So that's just one way that we can still provide you with that information, but it doesn't fit on this tag. So as I mentioned, we send these out at no cost. As soon as your participating pharmacy lets us know you need one, then we send it out. So they have a form that they fill out for each patient that needs one, and they let us know. And then we give you a call and remind you that you're borrowing it. And when you're all done, give it back. Basically, you can keep it forever if you're going to use it forever. But, you know, if you switch to a pharmacy that's not participating, we'll ask for it back. And then, you know, if you need it again, we'll send you a new one. So that's just one way that we can keep it free, and we can keep them out of landfills and recycle them, reuse them, keep them in circulation. So we do follow up with our customers about every 6 months. That helps us to keep track of these, but it also helps us to know if the pharmacies are doing a good job and actually putting the labels on for you. And if there's really any issues about them providing accommodations, you know, we can help to intercede there and help them to use the software more efficiently, or, you know, maybe improve their process of how they do Script Talk. So that's the basics of, I mean, it's a pretty simple system. You have the Script Talk tag or large print label or Braille. So once you're set up, it's so super easy. Right now, at this point in time, the challenge is getting set up. Not every pharmacy provides this service. And so I want to talk a little bit about advocacy as well. So I'm going to talk about advocacy, and then we'll go into the specifics of which pharmacies are doing it and which aren't. But let's just assume like your pharmacy is not currently providing an accessible prescription label, whether it's our label or another kind of accessible prescription label option. I usually tell people to subscribe to the idea of subsidiarity. So it's always best to start with the most local solution and then work your way up. Because if your pharmacist, hears your story and starts to understand like what your need is, that you need better communication, that you need this kind of accommodation so that you can safely manage your meds, you can talk to them about managing your meds. You can make sure they're not making mistakes. They can make sure you're not making mistakes. Everybody can make sure the doctor's not making mistakes. Like all that kind of communication, you need to have that information available to you so that you can be a part of that process. So speaking with your pharmacist about, this is my problem, and this is a solution that I have seen. And are you willing to provide this solution or, another solution? If you are a Medicaid or a Medicare patient, you can tell them this is the solution that is going to work for me. And actually, at least for, so long as the Affordable Care Act is in place, they would be actually required by Section 1557 of the Affordable Care Act to accommodate you with your preferred accommodation. And if they don't, you can file a complaint on the Department of Health and Human Services Section 1557 complaint form, which is all about discrimination and accommodations. If you are not a Medicaid or Medicare patient, you still fall under the ADA law, which says they need to provide some kind of effective communication, but the pharmacy gets to have more of a say of like what that looks like and what they consider affordable and so forth, because the ADA says they're not required to provide anything that will be a financial burden. That definition varies from person to person and pharmacy to pharmacy. We feel like providing this is not a financial burden. The setup for an independent pharmacy is approximately $200 a year to rent. If they want to rent, they can buy too, but if they want to lease the software and the equipment, it's $200 a year. And then the labels are extra, but the Script Talk label, because it has the microchip, is the most expensive. Those are about $2 a piece. The cost on providing the large print is a little bit different because it really depends on how many of these little booklet sheets they print off. Obviously, if you're only using 2, it's going to cost less than if they end up doing more. But it's really not that expensive. But we know that there are some pharmacies that the majority of their patients are Medicare, Medicaid patients, and they're not really getting fully reimbursed from the government all the time. So we can understand that too. But what we try and do is work with them and say, what is the best, in the long run, let's look at who's paying the cost, because somebody is paying. We all know that, right? Like if it's not the pharmacy putting the labels on, then you're paying someone to come in and help you manage your meds, or maybe it's the cost difference between living independently and having to pay for assisted living. We had one customer's son call, and their pharmacy was really giving him a hard time about getting set up. And because the pharmacy was like, well, we estimate that's going to cost $500 for us to get everything that we need to provide this. And but the customer's son was like, well, my mom wants to be in independent living, but without this, without being able to manage her meds on her own, she has to live in assisted living. And the cost difference is $500 a month. So, you know, you can provide this for $500 a year, or I'm going to pay $500 a month more. So, you know, looking at it from the larger scheme of things sometimes helps. We also, when we're talking to legislators about public policy side, the average medication mismanagement hospitalization costs about $10,000 for the government if you're on Medicaid or Medicare, or, you know, your insurance company ends up paying $10,000. So, you know, when you're looking at those kinds of numbers, it's definitely better off for our entire system, the health system, to just provide an accessible label that allows you to manage those medications all on your own safely. So, you know, when you're talking to your pharmacist, those are all some things that you can talk to them about. But I think your personal story is always the most important one. You know, what you specifically struggle with. These two medications feel the same. These two medications look the same, have the same color, whatever. Or I have a hard time remembering, you know, when to take them, or it's hard to refill because I don't know the refill number, so I can't use your automated system, and then I have to call you every time. It would be so much easier to use the automated system, which you can do if you know the number, which Script Talk can read out to you. There's just so many different things that go into play. So giving your story about, you know, maybe you skipped taking meds sometimes because you didn't know what they were and you didn't have anybody to come and help you. I know that's happened a lot during COVID when people have had less help coming into their home. So all those things. Now, if it doesn't work, your pharmacist says, you know what, my hands are tied, corporate won't allow me to do this. Then you have to go up to the corporate ladder. And I would say the next step would be, can I talk to your regional pharmacy manager? Because sometimes the regional managers can, you know, have a better relationship with whoever's in corporate. But you can also call the customer service, or every pharmacy chain should have a compliance officer for ADA and Section 1557 of the Affordable Care Act. So you can call and get the information or look online for the compliance officer information and lodge your complaint with the compliance officer. And then you can go higher than that as well. I mean, at the state level, you have your Human Rights Board, you know, Better Business Bureau, a Department of Justice, if we want to get to the federal level. What we've been working on more and more lately, though, is legislative work. You know, we know the ADA says that this is supposed to be provided, but not that many people have the wherewithal to file a Department of Justice complaint or lawsuit. You know, whether you don't have the time or the money. You know, so it would be so much better if the State Board of Pharmacy was the one who was making sure that pharmacies are compliant with the ADA. And so we've had a couple states, including Nevada and Oregon, pass laws in regard to accessible prescription labeling, so that it becomes part of state statute, and then it becomes a little bit closer to home and a little bit easier to enforce. So in Nevada, they were first, and their law actually says pharmacies are required to tell patients that audible prescription labels are available. So they had to tell patients it's available and where they can get them. So they're not required to provide them. They can say, well, I know you can get one and you can go down the street to this other pharmacy, or you can call Envision America or whatever. And that was really a big compromise because I think it was NFB that was working on that, but it could have been ACB. They were afraid that there'd be too much pushback from the pharmacists if they actually required it. Then a couple years later, Oregon Council of the Blind was working on similar legislation, and they said, well, we definitely want there to be stronger. Like, they have to be required to do it. So they really pushed for that language, and that is what they got. So since 2020, it has been required in Oregon for pharmacies to provide audible prescription labels. And so there's still some pharmacies that aren't set up to do that, but we've seen a lot come on board with our solution, and I assume some have went on board with other solutions as well. So that is something that people can always talk to their legislator about, your local representative and your local state senator, about, what, again, like with the pharmacist, what is your challenge and what is the solution? Because they want to know what their constituents are facing, but it's always nice to have a solution. And so, if you can say, it would be nice if we had a state statute that would require pharmacies to do this and the Board of Pharmacy could oversee it. So that is something that I just am working a lot with grassroots movements to start that conversation in their legislative bodies. It will probably take many years to plant that idea and really make it come to fruition in a lot of states. But the more people that bring it up, the more it's going to be on the forefront of a politician's mind. And maybe the next time they're working on some health legislation, maybe they can slip that in there. So it's definitely worth talking to them about that. So now I'm going to talk about which pharmacies are participating already.
Excuse me one second. Sharla, we're getting some questions in the chat.
Oh, okay.
And just wondering when you'd like to address those at the end, or can we? There's one from Vonda. Does the device erase old prescription of same medication with increase or decrease dosage and administrative times to prevent errors?
Okay. The information is actually on the bottle. So if you get a new prescription bottle, then it's a totally new label. So you're not going to have that. You're not going to have that problem. They should be creating a new label for every single prescription bottle that you get. So that is why we make it so that they can't reprogram these. They can't just reprogram it. So for that exact reason.
Awesome. Thank you. So the second question from Vonda, does the insurance company then approve or pay for another Script Talk pharmacy to fill the prescription if their in-network pharmacy doesn't have Script Talk labels?
Okay. So insurance isn't involved at all. This is an ADA accommodation that your pharmacy provides. If your current covered pharmacy does not provide this, I mean, you could ask your insurance if they would cover at another pharmacy because of them being incompliant. And I think once or twice I've had some insurance company case manager call me for more information and then say, you know what, we really should we should mandate that our pharmacies provide, make sure that they're following the law. You really can't make me go to a pharmacy that's not even following the law. It's a conversation to have. Whether they actually will allow you to switch to another pharmacy for that reason, I don't know. But what we would try and do more is try and get the pharmacy you're working with currently to get set up. That was always what we try and do, because our goal is to have every pharmacy being compliant. So but insurance isn't really involved otherwise because they don't pay for this service. This is a service that's paid for the pharmacy or by the pharmacy as an accommodation. They don't like charge the insurance for making their sidewalk curbs wheelchair accessible. They don't charge people extra for railings in the bathroom. They don't charge deaf people extra for having a sign language interpreter or anything like that. So they can't charge you extra for this service. If they do, they're not following the law.
Thank you.
We actually do have a few pharmacies that in small towns that ask their patient to pay a little bit extra. But most of the time those patients are they're like, fine, whatever. If that's what I have to do, I have to do it. But we tell pharmacies they're not really allowed to do that. But we aren't the board of pharmacy, so we don't monitor that. Like, we don't have any authority over it. That brings me to also, each of our pharmacies does provide it in a different way. So we sell them the software, the labels, the programmers, the printers for these, but the way that they label their medications, we don't have any control over. So we have some pharmacies like Walmart that will have the printer in their pharmacy. They will create the label the same day, exactly when you need it. But then we also have some pharmacies like Rite Aid. They do not have the printers in their pharmacy. They have the printers in their mail order pharmacy in New York. And then they all send a fax to New York saying, can you create these labels for me? And then they FedEx them to their local store, and then they put them on your medications. So then we have some that are like more local, like they might have like one pharmacy within 20 miles that will provide the labels for all the other pharmacies in that region. So, I mean, our goal is to have every pharmacy compliant, and we try and encourage them to do it locally because people shouldn't have to wait longer for their medication, especially if it's an acute medication and you're not used to taking that med and you really need the directions that day. But something is better than nothing. So what we do to try and encourage people to provide it locally is we give the very best pricing for the software and the labels to those companies that are planning on doing it in each store at the counter. And then the companies that have a different model of the more regional or national model or mail order, some pharmacies only provide it via mail order, then we charge them a little bit more because we said, if you're willing to buy into our vision of accessibility at the counter, then we're going to give you a discount. So that's how we try and promote them to do it the way that we think they should do it. And everybody, I think that's great. We want to give them that discount if they're willing to be part of that vision. So I mentioned Walmart. They do it at the counter. We're signing up new Walmarts every month. So they haven't gotten the supplies to every single store yet. They're doing it per request. So if your Walmart doesn't have the equipment to provide Script Talk yet, all they have to do is order the equipment from Walmart Corporate online, and then Walmart Corporate will send them the equipment and get them ready to go. But I would say we probably have at least 1,000 Walmarts already up and running. We do work with Rite Aid. We do work with the Albertsons Corporation. So that would mean like Jewel Osco, Dominic's, Safeway, Vaughn's, and any other. I think they have 10 different banners underneath of them. But if the banner is owned by Albertsons, they can participate. And that's on a per request basis. Again, so they're not going to put the equipment in the store to provide the labels until somebody asks for it. Then we also work with Publix if you're in the Southeast. Um, because Oregon passed a law, we work with Fred Meyer, which is part of the Kroger company. Although so far we only have 1 or 2 other Krogers that are set up. So that's something that we're still working on. We work with a lot of other smaller regional chains. In California, we also work with Kaiser, which of course they're an insurance company, but they also have their own pharmacy. So Kaiser will provide it. And they're actually a little bit different. They actually buy the units for their customers. So instead of being part of the Pharmacy Freedom Program where you borrow the unit, they'll actually buy you one to keep forever. And so let's see, then we also work with most of the major mail orders. So Express Scripts, OptumRx, Caremark, Humana, Aetna, Cigna, lots of others, lots of mail orders. We work with Accessible Pharmacy, which is a mail order that kind of specializes in services for blind people, and they'll even do pill packs and stuff like that for you. So we do work with them. The only 2 major pharmacies that we are not working with right now, in some way or shape or form, would be Walgreens. So they do not do Script Talk. They have their own talking pill reminder, which is a voice recording device that they stick on the lid. So they do that. They don't do our solution. And then CVS provides Script Talk through their mail order service. But in store, starting last summer, they're starting to roll out their own version of RFID tag, which they're calling Spoken RX. And they have an app so that you can hear Spoken RX. It looks exactly like our app. They just copied ours, but it's called Spoken RX. So if you download the CVS app and then under pharmacy, they have Spoken RX, which in my opinion is like 5 too many swipes to get to, but that's the way they designed it. So they're in the process of rolling that out, but I don't really know much about like what their strategy is on which pharmacies are getting set up first and how long it's going to take or anything like that, because that's not ours, but it's very similar to ours.
There's a question in the chat regarding DOD, and I think that's Department of Defense and military hospitals.
If it's a Veterans Administration hospital, they will have Script Talk. However, if it's like TRICARE or TRICAP, I don't remember what it's called, or some of those pharmacies that are for dependents that are mail order, they are not providing it yet. So it kind of just depends on if it's a base hospital, they probably are not providing it. But if it's a VA hospital, they will. So.
Thank you.
Mm-hmm. I'm totally open to questions. I kind of ran through my whole spiel. So whatever people have questions about, I'd be happy to answer.
Yeah, no, the information has been really great, and you covered quite a bit of the questions, because I had a couple that I had jotted down that have come up over the past week or so in some of our classes. So thank you for covering that. And we've had a couple of questions from the chat, but now would be a great time if anyone has a question. You may ask.
Vonda has her hand raised, I think.
Oh, okay.
Okay, this is Vonda. So the one question I did ask about each label on the prescription.
Wait just a second. Vonda, is there a radio or a television on in your background?
No, there isn't.
Okay. All right, go ahead.
So the question I had about potential prescription errors is in terms of if the person has the same medication, the doctor changes the prescription, how they should take it, or the dosage, will it erase the previous same prescription that they had of that same medication?
Yeah, so this doesn't store information. The information is stored on the medication bottle itself. So if you
Okay.
use up this bottle and you toss it in the garbage, that information is gone. Now, that being said, if you're using the app, there is a history feature. It will keep a history of the medications that you've scanned. So you would just refer to the most recent scan instead of the.
Okay. Okay, that's always the problem when we have patients bringing in their bottles and they have multiple bottles, but different regimens, you know, how they take it and stuff, and they get confused and they don't put an X on the label or store it someplace, and they're taking, you know, different times. It's not what the most recent. So thanks for clarifying.
Yeah, I would just, if they're using Script Talk, I would just highly recommend, you know, when you get a new prescription, throw the old one away. That solves that.
Yeah. Or
And
take it to their
that's
pharmacy.
good advice for everybody, you know.
Right, right. Okay, thank you so much.
Looks like we have a question from Jane. Go ahead, Jane.
What about those that I guess these are for over the counter, but what about those that are prescribed by a prescriber that doesn't have a RFID tag on it?
So this system is for prescriptions. So this is your pharmacy, the participating pharmacies that I'm speaking of, they actually add these labels to your prescriptions from your doctor. As far as over-the-counter medications, some of our pharmacies will label those for patients. Some of them will label them only if a doctor has also specified the correct dosage instructions for you personally, because some of the pharmacies haven't been wanting to be responsible for telling you to take the wrong amount of over-the-counter. So each pharmacy has a different policy as to labeling over-the-counter drugs. So you'd have to ask your specific pharmacy about that.
And have the pharmacies, have they grown over? Yeah, right.
Yes, definitely, especially in the last 5 years, because, well, and that's really because of the Affordable Care Act, because of Obamacare, because that put in Section 1557, the anti-discrimination clause, and so there's a lot more teeth to that than the ADA, because Health and Human Services can withdraw permission to be a part of Medicaid, Medicare, pharmacy services if you're discriminating. So since that law went into place, we've had a lot of pharmacies come on board. We had Caremark come on board. We had Walmart, and hundreds, thousands of others. So yeah, we're adding more every day. I'd say we probably add on average 30 to 50 pharmacies a month right now. So maybe a little less. Yes.
I just wanted to let one of our individuals know, I think it's Mary, there's feedback that's coming from your microphone, and that's why I have muted it. Did you have a question?
Yes.
Okay, go ahead.
I was just wondering, you mentioned earlier about I have a mail order from Express Scripts.
Yeah.
Do they do this prescription label?
Yes. Yes.
Oh,
and you would,
so I can request from them.
Yeah. You actually would call Envision America because we do the signups for them.
Oh, okay.
So why don't I go ahead and give that number right now for
Um,
everyone?
if we can do this, Charla, if you don't mind, I can send a follow-up email to all of our
Perfect.
participants today, and in that information, I'll provide the relevant contact information and telephone
Perfect, yeah.
numbers for how to access the program.
Great, yeah.
Okay.
So if you're Express Scripts, you can just call us. If you're anybody else, I would say start with your pharmacy first. And then if you don't make any headway, call us and then we'll help you. Exception because they asked us to take care of all their setups for them. So
Oh, but is that free?
yes.
Oh, okay.
Yep.
Okay, thank you.
You're welcome.
Awesome. Anyone else out there have a question for Sharla? This is a good time. The time is now 11:46, so we have a few more minutes. We had reserved 11 until 12, but if we finish up early, that's fine too. But I didn't want anyone to miss this opportunity to have a live person respond to your question if you should have one.
Yeah.
And it's nice that we have a manageable group. The size is just perfect for questions and answers and for receiving information. Fabian, he says it's a great workshop. We appreciate your feedback. So on that note, let's see, there is a question in the chat from it looks like from JM, and the script talk, will it be able to speak a different language?
Oh yeah, I didn't talk about the translation.
Great question.
Yeah.
Hello.
Yeah.
Yes, hi.
Okay,
This is
so
Denise.
Oh, Denise, if you could hold, we had just one question ahead of you, and we'll get to you next. Are you okay to hold for a second or two?
Yes.
Okay, thank you.
okay, so in regard to Jeannie's question about different languages, so our new script, this is speak in different languages. The real question is, can your pharmacy type the information into the software in that language? So that's the limitation there is,
I don't think
in
so.
order for it to speak it out loud in another language, they have to type it in that language. Now, if you want to have the low vision, large print label solution, our software can put can actually translate the directions into another language, even if the pharmacist doesn't know the language, and it prints out in a JPEG format, so the pharmacist doesn't have to type it in. He just chooses which warnings and directions he wants, and then it translates it for him. So if you want an audible language, or an audible label in another language, that has a lot of limitations. But if you want a large print label in another language, that is a little bit more feasible for our software. But that also assumes that the pharmacy is signed up for the translation service. So yes and no.
Okay, thank you. Let's go to Denise now. Denise, you had a question?
Thank you. I tried the *9 and it didn't seem to work.
Oh,
so I don't know.
it's *6. I'm sorry. For mute
I know
and
*6, but do you have a raised hand or not?
no, we don't have a raised hand, and I think that works for Zoom, but does not work for Microsoft Teams. Sorry about that.
Okay.
But
all right. My question is, do you provide technical support for the Script Talk mobile?
Yes. Yeah.
Okay.
You can just call our 800 number and we'll help you out with whatever's going on there, whether it's downloading or if you're having issues using it.
So is that the same number or a
Okay.
different number?
Same number.
Perfect. Okay. It'll be in what we send as follow-up. Okay.
Okay, thank you.
Good question, Denise. Thank you.
And I should also mention too, if you're wondering, is your phone compatible with our app, especially Android? If Script Talk Mobile shows up in the Google Play Store or the Apple Store, then it will work on your phone. So if it does not show up, if you cannot find it, that means your phone is not compatible. So you need an iPhone 7 or above if you're doing iPhone. Android, it's a little bit, hit and miss whether it has the near field communication chip or not. So again, if it shows up in the Play Store or the App Store, that means your phone will be compatible. But if it's totally missing, that just means your phone can't do it. So.
Okay, great. Thank you. Thank you for that. Okay, if there are no further questions, I think we at this time just want to say thank you so much, Sharla, for visiting with us today and for providing some very helpful information. And I want our guests to know that we will send you an email with all of the necessary information that you might need from today to be able to pursue Script Talk and get medication safety information. So thank you so much, everyone. Thank you, Sharla.
You're
Okay,
welcome
thank
very
you.
much. I'm
Thank you,
just
Sharla.
For
a little
share
promo.
all your information with us. I'm very
Thank you, Sharla.
I'm very proud of you.
Thank you.
And I'm going to include in
Thank
the
you.
email info a link to our next. I'm going to be hosting another Zoom call in March. It's about patient safety, and they're going to be giving some advice on, if you go to the hospital, how to advocate for yourself. So, and then we'll talk about the dual language labels as well in that webinar. So I'm going to put the link to that in what I send you, Wanda. And
Perfect.
if you want, especially if you're going to be going to the hospital and you want to plan ahead on how to advocate for yourself and make sure you have no medication errors and medical errors. That'll be a great workshop, I think.
Oh, that'd be great. I'll go ahead and add it to the information email that we send out, and we can also publish it in our weekly announcements for our students, because likely there'll be others that are interested. So anyway, thank you so much for
You are
everything.
welcome.
And I want to wish everyone a great day, and thank you all for your attention. Have a great rest of the week.